Back to you, Maureen.
Thank you, Brian. And a portion of the money we raise today will also go toward COVID-19 research being conducted at Notre Dame. And joining us now is Dr. Merlin Bruening, the Donald and Susan Rice Professor of Engineering and Chemistry and Biochemistry at the University of Notre Dame. So welcome to the show, Merlin.
Thanks for having me.
We're anxious to hear, what type of research during this pandemic are you and your team doing?
So we're trying to develop new filters, you might say. They capture antibodies. So we could take a small amount of serum from a patient's blood and then pass it through the membrane and hopefully capture all of those antibodies. And then we can label them with something that we can see on an instrument, fluorescence. And from that, we would hopefully be able to tell you how many antibodies to COVID-19 a person has.
Very interesting.
So unlike a company that might say, well, yeah, you had an infection, you have antibodies. Our goal is to say, yes, you had an infection, but you have lots of antibodies. So your plasma would be useful for maybe a therapeutic purpose. Or 6 months from now, we'd examine you again and say, your immunity is going down. So tracking that immunity is going to be a big deal in the
That is very interesting. So could you explain for us that, we don't have PhDs, what exactly a point of use assay is?
Yeah, so we want to develop filters that you could use where you go right into the doctor's office and 20 minutes later they say, here's your antibody level. So you don't have to wait, you have the information immediately. Okay. So right at the point of use.
That's wonderful. So what's different about your research that companies are not already pursuing? And we talked a little bit about that.
Yeah, so certainly the companies are doing a great job and they have far more resources than we do in most things. So they can tell you if you've been infected or not. But most of their tests are not looking quantitatively at how much antibody you have. So they wouldn't be able to tell you, yeah, is immunity fading? Does it fade in 6 months or 8 months or something of that nature? And they wouldn't be able to tell if this is a good person to donate plasma for therapy.
That's great. So companies are not already pursuing, what they aren't pursuing is a large-scale manufacturing. What's the potential next step?
So we definitely would need help with that as we get our apparatus going. We have collaborated before with companies because they have the ability to manufacture things on a large scale, and we don't. So we would collaborate with them, license technology to make new devices that maybe would need to be on the millions of devices scale.
It's very interesting that those of us who live around Notre Dame, we know how great a research facility it has become, but to think that you could have that type of part in finding out how our antibodies are and whether we could actually be donating our plasma and making a difference. Thank you very much for joining us today. We appreciate it, Merlin.
Thank you. I appreciate it.